Lawmakers in New York State are considering joining a dozen other states that allow students to take mental health days off from school. The proposal is expected to be introduced this month in Albany, and tonight, CBS 2's Carolyn Gusoff reports the intention is to make emotional wellness a health priority.
The stresses of growing up, amplified by the isolation of the pandemic, have created a generation of anxiety and depression, with suicide on the rise. In South Huntington, Walt Whitman High School now offers students counseling at a nearby urgent care center, removing the stigma of asking for help.
Students who are kind of just like maybe struggling with something and just need a day to go somewhere.
New York State is considering going even further. This bill would add school mental health days off, like sick days.
If parents saw mental health as equal as a sick day, maybe they would allow it, and it would help kids who are struggling.
Experts who work with teens say it would open communication with parents and can spur life-saving intervention.
If a child's communicating, I want to take one of those mental health days, you now have the opportunity to not only discuss it with your child, you help the conversation become very natural about mental health.
Not all educators think yet another day off from school is most effective. The superintendent of the Baldwin School District says an extra day off still doesn't get to the root of the problem. In fact, it can even lead to chronic absenteeism, while the problem remains hidden and unresolved.
You don't think kids would take advantage?
No.
I feel like especially with like having that kind of like limit of maybe like 3 to 5 days.
The Department of Education would determine the limit on mental health days. All work must be made up. Plainview Old Bethpage JFK High School has allowed them, and the principal reports no abuse of the system.
Not at all. We were able to identify some students that were using them more than we wanted to see, which gave us an opportunity for the assistant principal and social worker to reach out to the family to say, what can we do to help your child?
Advocates say it ought to be for teachers, too.
Burnout is real. And I think we look at burnout as this separate category. It's not. Burnout is that cumulative effect of how those life stressors start to impact our overall mental health.
The proposal has been introduced and failed in Albany for 4 years. But with data showing that the pandemic dramatically impacted mental health, supporters say there is new urgency. In Plainview, Long Island, Carolyn Gusoff, CBS 2 News.